This presentation is entitled Evolving Models of Remote Examinations in 2021. Specifically, it will address the transition from the conventional in-person exams of the American Board of Radiology to the remote exam model, which will be rolled out early next year. This transition was, of course, prompted by the current pandemic. I'm Brent Wagner. I'm one of the presenters, and I'm very happy to be joined by Drs. Velez, and McConnell, who are members of our initial certification advisory committee that help us develop these processes within the American Board of Radiology. The topics we'll be covering include process and philosophy, the basic characteristics of computer-based remote exams, the oral exam model for radiation oncology, medical physics, and interventional radiology, and then lastly, the significance of inputs from the advisory committees and program faculty. I'm currently the executive director of the ABR. For more than 20 years prior to taking this position earlier this year, I was in private practice as a radiologist, and during that time I served as a volunteer item writer and board member of the ABR. I've included my email address, and I hope that if you have suggestions or want some clarification or additional information, that you'll reach out to me. I'd be glad to hear from you. I also want to emphasize that this information represents what is known during this week. We're recording on October 15th, 2020. By the time you're viewing this presentation, there will indeed be updates, and those will be available on the ABR's website. So please check there for the most up-to-date information. When looking at board certification exam parameters, whether they be in-person or remote, we need to consider security to some degree. And this includes content, because the content belongs as part of the exam process and is not for public distribution. But it also includes something new in the remote exam setting, and that is the cultural acceptance of some level of intrusive remote proctoring. The ABR takes the stance that we will be treating professionals as professionals. That is, with trust and with acknowledgement of near universal academic integrity of the highest standards. Acknowledging that some level of security is important to maintain the validity of the process, we will have remote proctoring. This will allow individuals to take the examination in their home or office. We will be using commercially available live and artificial intelligence proctoring solutions that are very similar to models used in colleges and universities. We also need for the exams to be fair and consistent. The environment will be largely up to the individual, but it must be free of noise, interruptions. The exact environment, as I say, will be the responsibility of the candidate himself or herself, but within fairly broad restrictions, this should be easily accomplished for our examinees, and of course will not require travel to one of our exam centers. The exam should be practical, that is at the lowest possible cost, and that's what we're doing. We don't intend to increase fees for 2021, but we are very mindful of maintaining costs as low as they can possibly be with all of the decisions at the ABR. We also want a reliable and simple IT platform and user interface, given that our candidates will have ample practice opportunities. The reality is we don't want the process itself to be a distraction or something that's cumbersome or difficult to work with. And that really overlaps with the idea of optimizing the candidate experience. And with that in mind, we're trying to provide as much flexibility as possible for breaks during the day. We appreciate that there will be inevitably some disruptions in Wi-Fi connectivity, and we want to build in recovery periods for that, and also accommodations for physical disabilities or for nursing mothers. We feel that overall the remote environment offers a way to improve and optimize the experience in this regard. Lastly, we want it to be valid, and it really relates to some of the parameters I discussed earlier. Requires some level of security in order to be credible to the public, and we want ultimately for the exam to recognize a significant level of achievement and accomplishment, many years of training for the candidates for our exams, and at the end of the day, we want it to be valuable to those candidates because it correlates with that high level of achievement and accomplishment. So at this point, I'll turn things over to Dr. Velez. Thank you.
Hello, my name is Erik Velez, and I am a PGY5 diagnostic radiology resident at the University of Southern California and one of the members of the ABR Initial Certification Advisory Committee. I also serve as the Vice Chair of the RSNA Resident and Fellow Committee. I will be discussing the characteristics of the computer-based remote exams pertaining to the upcoming qualifying and core examinations. When designing remote certifying exams, it is important to develop a reliable and easy-to-use platform that ensures candidates' performance is based on knowledge rather than the ability to navigate the platform. In addition, developing some level of security is necessary to guarantee the validity of the certification process and to protect candidates' personal information. To this end, the ABR has designed an easy-to-navigate exam platform that can be taken from your own computer while using a combination of live and AI proctoring solutions to ensure a secure, less intrusive exam process. The overall model of the exams will be similar to prior years, with changes made to accommodate the remote candidate experience. The total number of questions and content for the upcoming core and certifying exams will be the same, with already developed 2020 exam content converted to the new delivery platform. To address challenges candidates face with taking the exams remotely, the exams have been broken into multiple sessions. In addition, the allotted time is significantly more than the vast majority of candidates have needed in the past to complete prior exams. This will allow candidates to focus on the exam content rather than speed, and help serve as a buffer in the case of internet connectivity issues. The certifying exam will be 2 sessions on the same day of approximately 3 hours each. The core exam will be administered over 3 days with 2 sessions per day of approximately 2 to 3 hours each. There will be at least a 1-hour break between each session. In addition, candidates will be given at least 15 minutes of break time within the test sessions, which can be used at the candidate's own discretion. To take the exams, candidates will need a laptop or desktop with a webcam and have access to a non-public location, such as a home or office at their institution, with a reasonable internet connection. Due to the nature of the remote proctoring, candidates will also need to be alone and free of interruptions during the exam sessions. The IT platform is designed to be simple and easy to use and functional across multiple operating systems. However, currently tablet devices such as the iPad will not be supported for the remote exams. The remote platform is designed in a format similar to that already being used for maintenance of certification questions. Candidates will be able to control the images, including zooming in, windowing, and scrolling when appropriate. Questions can be flagged and returned to at any time during the session, and overall progress, break time remaining, and exam time remaining will be visible throughout the exam process. The platform allows for easy case navigation to review questions and will provide a calculator function if needed. In addition, a start break button will allow candidates to take breaks during a session as needed. However, please note, this design was taken from a pilot model and is subject to change. To ensure candidates do not face technical issues on exam day, the ABR is creating a practice exam that will simulate the remote exam experience and platform. By using the practice exam, candidates can download and test the necessary software for the remote exam process prior to the actual exams. In addition, the practice exam will allow unlimited attempts in case candidates update their computers or desire more experience navigating the remote platform. Pilot exams will be performed with a diagnostic radiology certifying exam to test the function of the platform on a larger scale. This exam was chosen due to the shorter exam length and appropriateness compared to the core exam. We hope these steps will help provide candidates with as smooth of an experience as possible when taking the remote exams. Lastly, the grading process of the February core exam will be expedited with results available within 30 days of the test. Up next, Dr. Ahn will be discussing the oral exam model.
Hello, my name is Thomas Ahn, and I am a PGY4 integrated interventional radiology resident at Massachusetts General Hospital. I am one of the members of the Initial Certification Advisory Committee and will speak briefly about the oral exam model, which applies for certifying exams for specialties such as interventional radiology and others. On this slide, I have also listed my email address if you would like to contact me with any questions. The certifying exams with an oral component will utilize a combination of commercially available video conferencing software with an exam platform that the ABR is actually developing de novo. The ABR is working to refine this new platform so that it is as intuitive as possible for the candidates taking the exam. We are gathering lots of input from ABR trustees, advisory committees, and prior oral examiners to develop a platform that candidates will feel comfortable with. I will display a screenshot in a couple of slides from a previously administered pilot exam, which should help provide a visual of how the current iteration of the platform appears. A unique aspect of the oral exam will be an assigned navigator that will provide one-on-one assistance to ensure that the exam platform functions smoothly for each candidate. The purpose of the navigator will be to guide each candidate through the exam by being available to answer questions as they come up. We hope that this additional resource will decrease the likelihood of technical glitches during transitions between different portions of the exam. As in the recent past, these points will not apply to certifying exams in diagnostic radiology that do not have an oral component. There will also be 2 simultaneous examiners during each candidate's oral exam, with one examiner actively discussing the cases with the candidate and another examiner discreetly observing. The rationale for having 2 simultaneous examiners is to have the second observing examiner as a backup in case of a technical issue with the first examiner. The second examiner will observe the entire time, record scores, and make observations about the candidate's performance. Therefore, the second examiner should be ready to step in seamlessly to continue the oral exam in case of any connectivity issues. The decision to have 2 examiners was based largely on early experience from other medical boards that have trialed oral exams in a remote setting. Experience from prior remote oral board exams have suggested that connectivity issues may be expected in up to 10% of exams, so the hope is that the second examiner would provide an effective backup in case of technical issues. For example, if the internet connection were to drop with the first examiner in the middle of the exam. The ABR will be recruiting additional oral examiners to accommodate this decision. Overall, we do acknowledge that the security of remote exams in the context of both computer-based exams like the core and oral certifying exams is less robust than the previous in-person model. However, this is the situation that we find ourselves in given the current pandemic and limited ability to travel and gather together. As Dr. Wagner mentioned, in designing our exam platforms, we are drawing on remote exam experiences from models both from higher education and other medical specialty board experiences. Overall, we have tried to keep the focus on the candidate experience with a balance between security and validity of the test and limiting the intrusiveness of the exam platform. The ABR is making every effort to make sure that the candidate has a secure, smooth test-taking experience and that all candidates will have the opportunity to perform a technical check to confirm software, monitor, and microphone compatibility prior to the exam. On this slide, we have a screenshot from the ABR-developed exam platform, which will be used to display images to the candidates. While the examiners will control the display of the images themselves, the candidates will have control of a cursor that they may use to point to or outline structures to answer questions and aid in their discussion. In this case, the mouse icon centered over the aortic root is labeled as the examinee or test taker. The candidates will also be simultaneously engaged in a video conference call with the examiners, so they may engage in dialogue about the cases, and this format will be unchanged compared to the old exam model. Note that this image is taken from a pilot model of the exam platform from a recent administration and may be subject to updates. Overall, the format of the exam will remain unchanged compared to the 2019 model, besides the transition to the remote administration. There will continue to be one-on-one exchanges with the oral examiners with multiple sessions and multiple different examiners. The breadth and scope of the exams also will not have changed compared to prior years. Overall, the ABR's goal for the remote oral exams is to provide as smooth a test-taking experience as possible that is intuitive for the candidates and accurately tests knowledge and not the ability to navigate new technology. If you have any further questions, please feel free to reach out to me via email. Next, Dr. McConnell will provide the concluding remarks for this talk.
I'm currently a new assistant professor at the University of Alabama at Birmingham in the Radiation Oncology Physics Department, and I'm an active member of the Medical Physics Initial Certification Advisory Committee for the ABR. Before I started down the path of a medical physicist, I used to work for Accenture as a consultant where we did large-scale technology integrations and designed new platforms for our clients, particularly when clients wanted to move processes from something paper-based to something digital. And that to me is sort of similar to what the ABR is having to go through right now, so I do have some experience in projects like this. And I'll say the process the ABR is following to bring a solution to the table is definitely in line with the same processes that Accenture would use to create the solution in the case of what is essentially a process redesign and a new software integration. It, of course, starts with understanding the problem, setting the requirements and framework that will go into a solution, designing that solution, and then, of course, implementing it for long-term operations. The ABR realized it had an issue and began identifying all the pieces of the problem to really understand what that meant months ago. I think a key takeaway that I learned from doing these sorts of projects is that the more due diligence you perform in diagnosing the problem and setting requirements, the overall better solution you'll have in the end. Part of what makes this problem challenging is that the ABR is responsible for the boarding of many disciplines, including radiation oncologists, therapy, diagnostic, and nuclear medicine physicists, radiologists, and interventional radiologists. As Dr. Wagner pointed out, the ABR, of course, has their own set of requirements for exams, as well as other very real constraints like cost and time to design a solution. They want exams to remain secure, fair and consistent, practical, give an optimized candidate experience, and be valid. And they have to do this across all of these disciplines. Of course, there's overlap in the problems and the requirements of the exams, but there are differences too. And a big part of setting requirements is speaking with people who directly will interact with the software and the new oral exam models. And that's where the role of these advisory committees come in, as well as where the examiners come into. Specifically regarding the advisory committees, for anyone that doesn't know, there's one for each discipline, and they meet at least annually and are comprised of students, residents, and program directors. And it became very clear early on these needed to be utilized more than ever before so that the ABR could have a direct line into the students' concerns, requirements for the exams, the needs for each discipline, and be able to integrate them together into one solution that can be flexible enough to host and deliver all of the exams. And I hope, as you heard from my colleagues earlier, the ABR has been carefully considering how to do that exact thing. There are some very obvious advantages of remote exams. Of course, the most obvious is that examinees and examiners don't have to travel, and it also provides greater flexibility for the candidates, specifically in the case of making more flexible accommodations that weren't always easy to implement gracefully before. More importantly, virtual exams are going to be a complete paradigm shift to what we've operated in the past, and they seem to come with many benefits for examinees. But on the flip side, there are also many concerns that were brought up in these advisory committee meetings by the examinees. And I know in the case of the physics committee, there was some real apprehension from examinees about switching to a virtual exam, even though we knew it offered greater long-term flexibility. There was concern about implementing a solution too fast without the proper thought, and so I want to use this remaining time to show that the proper thought was there, and the current solution directly relates to input by these advisory committees. A big question I heard from multiple people was, will my exam be so different from the 2019 candidates exam that I'm somehow at a disadvantage? And from the ABR side, they've made it clear that keeping the exams fair and consistent is a critical priority. They're responsible for designing exams that meet consistent testing standards and eliminate bias. On the oral exam side, you can see that they've maintained the face-to-face component, examinees can interact on the screen, and they will have the ability to draw just like before. Another common theme question was that examinees were worried about feeling unfamiliar with the testing process and the platforms, and that may shift the focus of the exam away from demonstrating your knowledge to demonstrating that you can navigate software. The ABR wants to do everything possible to make sure that's not the case. They're offering unlimited prep sessions, as well as having a meeting with your navigator prior to the exam to make sure you know what you're doing. It was also brought up that some new exams in the past that were delivered through Pearson came with some unexpected issues that contradicted what was explained on the website. And candidates were worried that moving to a virtual platform presented the ABR with a challenge much larger than just implementing a new written exam in Pearson. But on the flip side, designing a new process and platform does require much more testing than ever before, and the ABR has outlined that with the beta testing and the pilot testing. Some people were also worried that the security features might create a rigid environment, but the overall exam itself offers much more flexibility in the candidates' lives, and even the exam itself offers some comforts like using your own equipment, flexible breaks, and less interruptions to your work and personal life that seem to outweigh any of the intrusive security features. And of course, lastly, the scariest issue for the ABR and examinees is what if something goes wrong with the technology that day? To mitigate this, requirements for your system will be clearly communicated ahead of time. There will be tech checks ahead of time, ample opportunity for you to interact with the system and become familiar. And along with the navigator, there will be a backup examiner ready to jump in on your exam day. The designing of this virtual exam has taken the input of many people. And the last thing I want to say is please understand the design of this virtual solution is iterative, and the most up-to-date information can be found at theabr.org. Should you have any questions or concerns, please reach out to the ABR directly or reach out to your appropriate advisory committee, as they can collate ideas and present them to the ABR also. Thank you.